Acute hemolytic anemia, warm agglutinin AIHA. Etiology is drugs, penicillin. Infections, viral and autoimmune immunodeficiency. Lymphoproliferative, that is CLL. Cold agglutinin AIHA, this infections, it is mycoplasma pneumonia, infectious mononucleosis and lymphoproliferative disease. In clinical presentation, there is warm, is asymptomatic and life threat. Direct Coombs test is anti-IgG, anti-C3. Cold, it is anemia symptoms and livedo reticularis and acral cyanosis, cold exposure that is disappears with warming. And direct Coombs test is anti-C3, anti-IgM. Treatment is warm, corticosteroids, splenectomy and refractive disease. Cold, it is avoid cold temperature, rituximab and fludarabine. Complication includes warm, venous thromboembolism and lymphoproliferative disorders. Cold includes complication such as ischemia, peripheral gangrene, lymphoproliferative disorders.